HESI A2 Anatomy and Physiology Endocrine System. Introduction to the Endocrine System. Welcome back to our HESI A2 Anatomy and Physiology series. In this video, we'll explore the endocrine system, your body's chemical communication network that works alongside the nervous system to regulate virtually every bodily function. By the end of this video, you will be able to describe the function of the endocrine system, identify major endocrine glands and their hormones, understand how hormones regulate body processes, explain negative feedback mechanisms, recognize common endocrine disorders. Overview of the endocrine system. The endocrine system consists of glands that produce chemical messengers called hormones. What are hormones? Chemical messengers released into the bloodstream, travel throughout the body to reach target cells, regulate specific physiological processes, work more slowly but last longer than nerve signals. Primary functions of the endocrine system: regulates metabolism, controls how cells use energy, controls growth and development, manages physical maturation, maintains homeostasis, keeps internal environment stable, regulates reproduction, controls sexual development and fertility, manages stress responses, helps body adapt to challenges. Endocrine versus nervous system. While both systems control body functions, they work in complementary ways. Endocrine system characteristics: speed, slow response, minutes to days. Communication, hormones travel through bloodstream. Duration, long-lasting effects. Reach, affects multiple organs throughout body. Examples: growth, metabolism, reproduction. Nervous system characteristics: speed, fast response, milliseconds. Electrical signals through nerves. Duration, short-term effects. Reach, specific target locations. Examples: reflexes, muscle movement, sensory perception. Working together. Nervous system provides rapid, precise control. Endocrine system provides sustained, widespread regulation. Many processes involve both systems coordinating responses. Hypothalamus and pituitary gland. The hypothalamus and pituitary gland form the command center of the endocrine system. Hypothalamus, part of the brain that connects nervous and endocrine systems, produces hormones that control the pituitary gland, monitors blood chemistry and body conditions, responds to signals from other brain areas. Pituitary gland, the master gland, located at the base of the brain, divided into two parts. Anterior pituitary hormones. Growth hormone, GH, promotes growth and metabolism. Thyroid-stimulating hormone, TSH, stimulates thyroid gland. Adrenocorticotropic hormone, ACTH, stimulates adrenal glands. Follicle-stimulating hormone, FSH, regulates reproduction. Luteinizing hormone, LH, controls reproductive functions. Posterior pituitary hormones. Antidiuretic hormone, ADH, regulates water balance. Oxytocin stimulates uterine contractions and milk release. Thyroid and parathyroid glands. These glands in the neck regulate metabolism and calcium balance. Thyroid gland. Butterfly-shaped gland in front of the trachea. Controls metabolic rate throughout the body. Thyroid hormones. Thyroxine, T4, and triiodothyronine, T3, increase metabolism. Speed up cellular processes. Increase heart rate and breathing. Raise body temperature. Affect growth and development. Calcitonin lowers blood calcium levels when too high. Parathyroid glands. For small glands on the back of the thyroid. Parathyroid hormone, PTH, increases blood calcium levels. Stimulates calcium release from bones. Increases calcium absorption in intestines. Reduces calcium loss in kidneys. Together, calcitonin and PTH maintain proper calcium balance for bone health and nerve function. Adrenal glands. The adrenal glands sit atop each kidney and respond to stress while maintaining daily functions. Adrenal cortex, outer layer. Cortisol, the primary stress hormone. Increases blood glucose for energy. Suppresses immune system during stress. Affects metabolism and inflammation. Aldosterone regulates sodium and potassium balance. Controls blood volume and pressure. Maintains electrolyte balance. Adrenal medulla, inner layer. Epinephrine, adrenaline, fight or flight hormone. Increases heart rate and blood pressure. Dilates airways and pupils. Increases glucose availability. Norepinephrine works with epinephrine. Constricts blood vessels. Increases alertness and arousal. These hormones prepare the body for emergency situations while maintaining daily balance. Pancreas, blood sugar regulation. The pancreas has both endocrine and exocrine functions, with critical roles in digestion and metabolism. Endocrine function, islets of Langerhans. Insulin produced by beta cells. Lowers blood glucose levels. Promotes glucose uptake by cells. Stimulates glucose storage as glycogen. Released after meals. Glucagon produced by alpha cells. Raises blood glucose levels. Stimulates glucose release from liver. Promotes glucose production. Released during fasting. Glucose homeostasis. Normal blood glucose, 70 to 100 mg/dl fasting. After eating, insulin reduces high glucose. During fasting, glucagon prevents low glucose. This balance prevents diabetes and hypoglycemia. Exocrine function. Produces digestive enzymes released into small intestine. Helps break down carbohydrates, proteins, and fats. Gonads, ovaries and testes. The reproductive glands produce sex hormones that control sexual development and reproduction. Ovaries, female reproductive glands. Estrogen, primary female hormone. Develops female secondary sexual characteristics. Regulates menstrual cycle. Maintains bone density. Affects cardiovascular health. Progesterone, pregnancy hormone. Prepares uterus for potential pregnancy. Maintains pregnancy if fertilization occurs. Works with estrogen and menstrual cycle. Testes, male reproductive glands. Testosterone, primary male hormone. Develops male secondary sexual characteristics. Promotes muscle and bone development. Maintains sperm production. Affects behavior and mood. Functions throughout life. Puberty, triggers sexual maturation. Adulthood, maintain reproductive function. Aging, gradual decline affects various body systems. Hormone action, target cells. Hormones only affect specific cells that have matching receptors, like keys fitting specific locks. Two main types of hormones. 1. Steroid hormones, lipid-soluble. Can pass through cell membranes. Bind to receptors inside cells. Directly affect DNA and protein production. Examples: testosterone, estrogen, cortisol. Effects, usually slower but longer lasting. 2. Non-steroid hormones, water-soluble. Cannot pass through cell membranes. Bind to receptors on cell surface. Use second messenger systems inside cells. Examples: insulin, growth hormone, adrenaline. Effects, usually faster but shorter lasting. Receptor specificity. Each hormone binds only to specific receptor types. Target cells must have appropriate receptors. Explains why hormones affect some tissues but not others. Negative feedback mechanism. Most hormone levels are regulated through negative feedback loops that maintain balance. How negative feedback works. System responds to changes by opposing them. Like a thermostat maintaining room temperature. Prevents hormone levels from becoming too high or low. Thyroid hormone regulation example. Low T3/T4 detected by hypothalamus. Hypothalamus releases TRH, thyrotrophin-releasing hormone. TRH stimulates pituitary to release TSH. TSH stimulates thyroid to produce T3/T4. Rising T3/T4 levels inhibit TRH and TSH release. System returns to balance. Benefits of negative feedback. Maintains homeostasis. Prevents dangerous hormone fluctuations. Allows fine-tuning of physiological processes. Most endocrine functions use this mechanism. Diabetes mellitus. Diabetes is a group of disorders affecting blood glucose regulation. Type 1 diabetes. Cause: autoimmune destruction of insulin-producing beta cells. Age of onset: usually childhood or adolescence. Treatment: requires insulin injections for life. Characteristics: little or no insulin production. Rapid onset of symptoms. Accounts for 5 to 10% of diabetes cases. Type 2 diabetes. Cause: cells become resistant to insulin, eventually beta cells fail. Age of onset: usually adulthood, increasingly in children. Treatment: diet, exercise, oral medications, sometimes insulin. Characteristics: insulin resistance followed by insufficient production. Gradual onset of symptoms. Accounts for 90 to 95% of diabetes cases. Common symptoms: excessive thirst and urination. Unexplained weight loss. Fatigue and weakness. Blurred vision. Slow healing wounds. Hypothyroidism versus hyperthyroidism. Thyroid disorders demonstrate how hormone imbalances affect multiple body systems. Hypothyroidism, underactive thyroid. Cause: most commonly Hashimoto's thyroiditis, autoimmune. Symptoms: fatigue and weakness. Weight gain despite poor appetite. Cold intolerance. Slow heart rate. Constipation. Depression. Dry skin and hair loss. Treatment: thyroid hormone replacement therapy. Hyperthyroidism, overactive thyroid. Cause: most commonly Graves' disease, autoimmune. Symptoms: nervousness and irritability. Weight loss despite increased appetite. Heat intolerance. Rapid or irregular heartbeat. Frequent bowel movements. Anxiety. Bulging eyes, in Graves' disease. Treatment: antithyroid medications, radioactive iodine, or surgery. Cushing's syndrome and Addison's disease. Adrenal disorders show the importance of cortisol balance. Cushing's syndrome, too much cortisol. Causes: pituitary tumor producing excess ACTH. Adrenal tumors. Long-term corticosteroid medication use. Symptoms: weight gain, especially in face and upper back, moon face. Purple stretch marks. High blood pressure and blood sugar. Muscle weakness. Easy bruising. Mood changes. Addison's disease, too little cortisol. Causes: autoimmune destruction of adrenal cortex. Infections or other damage to adrenal glands. Symptoms: fatigue and muscle weakness. Weight loss and decreased appetite. Low blood pressure. Darkening of skin. Salt cravings. Nausea and vomiting. Treatment: hormone replacement therapy with corticosteroids. Key takeaways. Let's review the essential concepts from this module. The endocrine system regulates body processes through chemical messengers called hormones. Major endocrine glands include hypothalamus and pituitary, control center, thyroid and parathyroid, metabolism and calcium, adrenal glands, stress and electrolyte balance, pancreas, blood sugar regulation, gonads, reproductive functions. Hormones work through specific receptors on target cells, with steroid and non-steroid hormones acting differently. Negative feedback mechanisms maintain hormone balance and prevent dangerous fluctuations. Common endocrine disorders include diabetes, blood sugar regulation problems, thyroid disorders, metabolism problems, adrenal disorders, cortisol imbalances. Endocrine health affects virtually every body system and requires proper nutrition, exercise, and medical care. Thank you for watching. You now understand how the endocrine system's chemical messengers work in harmony with the nervous system to regulate your body's complex functions. Remember that the endocrine system you've learned about today affects every other system we study. Hormones influence heart rate, breathing, digestion, and even bone formation. Keep connecting these concepts as you continue your HESI A2 preparation. See you in the next video.